So let's just do a quick overview of Medicare and how it works. So Medicare consists of Part A, B, C, and D. Part A is hospitalization. Part B is anything outside the hospital. C is Medicare Advantage, and D is prescription drug coverage. So you should always, in my opinion, turn to a local agent to help guide you. Medicare Part A and B are considered original Medicare. Part A is zero premium as long as you've worked 40 quarters in the US. Part B, you're going to pay the standardized premium that is set by the federal government. Typically, they tell us whatever that's going to be in the fourth quarter of every year. So that's what everyone pays to be part of the Medicare program, unless you make less or more money. So if you make more money, you're subject to an IRMA, which is an income related modified adjusted amount, and you pay more for both Medicare B and D. Or if you make less money, then your state Medicaid would help you cover that standardized Part B premium. Once you have Medicare Part A and B, then it's up to you. And again, my advice would be to work with a licensed local agent to help you decide which is going to be the best coverage for your medical needs. One option is to do a Medicare supplement or Medigap plan. With a Medicare supplement, original Medicare pays the first portion of your bills, and then the Medigap policy picks up where that leaves off. So as long as the procedure you're having is coded and covered under original Medicare, then the Medigap plan would cover that. Those are plan letters A through N, and you just get to determine what you want that plan to cover for you. As of 2025 enrollment period, the most comprehensive plan available on the market is the G plan. And every G plan from every carrier must cover the exact same thing. The only thing that's different, of course, is the extra benefits if a supplement plan is going to offer it, such as a gym membership or some discount programs, as well as the premium. So your premium and additional benefits differ on Medicare supplements, but every G plan must cover the same thing as every other G plan. The other option for Medicare is to get a Medicare Advantage plan. Medicare Advantage is Medicare Part C, and with Medicare Part C, that covers your A hospital, B doctor, and D drugs all in one convenient plan. So Medicare Part C, it combines, it's convenient, and it's offered by private insurance companies. And it is called Medicare Advantage because those plans have to offer advantages over original Medicare, such as dental, vision, and hearing. So those have been very popular plans that we've seen a lot of people really get into because they want that coverage. And what I recommend, again, is that you work with an agent to help find the best plan for you. Every company has a different network. So when you're on a Medicare Advantage plan, you do want to look at the company's reputation and their network size to make sure that the doctors that you're enjoying seeing now are in that plan's coverage. But most important, especially approaching 2025, is to make sure that your drugs are on the formulary. So if you choose a Medicare supplement plan, you have to have a standalone Part D plan. Well, you don't have to, but most people would choose to. And that's a plan that will cover your prescription drugs. But when you're on a Medicare Advantage plan, the drugs are included in the coverage for your Medicare Advantage. So you just want to make sure that the drugs are covered and on the formulary for whatever plan you choose, because for 2025, because of the Inflation Reduction Act, the most a consumer will spend out of pocket towards their prescription drug cost on Part D of Medicare is $2,000, as long as your drug is on that plan's formulary. So please make sure that you're paying careful attention to the annual notice of change that you got in the mail, outlining the differences between your 2024 and 2025 plans.